guys, this is Dr. Shivam, and yes, I have come to remind you that this is the month of August which is coming. So July is going to end and you are entering into the month of August. But the thing is, you should not get very much anxious because you still have time. Yes, you heard me right. You still have time, you still can do this thing. That means you still have time to pick up your rank from very far to the rank where you want, to the rank you deserve. So this coming month means start from now, but this coming month, target your coming 2 months for the things you have still pending. That means whatever subject you haven't completed, finish them up. So this is the month of July. Now you have month of August, September, October, November and December. So you can count it on your fingers. So less time. So time is never more. For the people who are overconfident, I would like to tell them that for them the time is never more. If they haven't started giving their 100% yet, for them the time has come. Start giving your 100%. This is the time, this is the phase which needs it. This is the time when you have to show what all you have, what all you can do and what all you want to achieve, because this time is going to decide what rank you are going to get next year when the results will be out and you have to see the results. So imagine that time and put your 100% effort from now on. Bang on, man. You can and you will achieve it. Believe on you and you will do it. Okay, so you have month of August, say with me, August, September, October. So in this August and September, you will be finishing your left out subjects. You will be doing whatever you haven't done up till now. So don't focus much on revision now, but try to complete these 2 things. That is whatever subjects is left now. Tell me what all is left for you. If you need any suggestion, comment it there. I will try to help you. So in this 2 months, you will be finishing whatever is left from your 19 subject. So target this August and September for completing it, and in the month of October you are going to do your first revision. That means before the November Aims you have revised your subject at least once. So the time is no more for you. Finish whatever is there in your mind giving you fear that you won't be able to solve the questions once it comes in your exam. Like for me, if you take, for me it was pharmacology, it was microbiology, it was pathology. So these subjects are vast but they are very important. So try to target your fear factors, finish them up as early as possible. Give them some little extra time and finish it up. I believe you will be able to do it. Now in the month of October, 1 revision. November there will be many exams like Aims, PGI. So you will be giving those Aims and all, but never keep your November and October for further revision. For revise your notes, whatever you have studied, your handwritten notes, solve MCQs, what is left there, and give yourself little time to analyze what all you need to do, what all you have done wrong before and you need to improve this time. So think and write in a notebook what all is left for you, what all you need to focus more, which type of question you are having trouble in. Think them, it will solve most of your queries, most of your fear which you have during the exams. Another thing is, planning is very important. I would say you to plan every month of you from now, every week of you from now, and every day of yours from now, because without planning you won't be able to judge yourself where you are standing. Giving a grand test is equally important. Try to give a grand test in 15 days. So grand test plays a very important role, because you can judge and you will be getting the motivation to study what all you have done wrong. So at least, irrespective of your preparation level, irrespective of the things you have done up till now, give a grand test in 15 days. I assure you it will help you a lot. So from now you'll be planning your month, planning your week and planning each day of yours. So still I will say you that you are very close to your victory, and don't dare to give up now, because this is the time which needs a very motivated mind, because in the end, in the exam hall, in front of computer screen, you will be taking your confidence as well as knowledge with you. So if this confidence is not there, this knowledge won't help much. So you should have both a self-belief in yourself, and the knowledge you want is already you are taking up, but the confidence should be there. So for that, I would like to tell you some more things. I'll show you some things like this. Okay, so here some more quotations, some more things like, don't tell me you can't. When you focus on problems, you will have more problems. When you focus on possibilities, the possibility of completing your syllabus, you will have more opportunities. You will be able to do it. And anytime you think of giving up, remember why the hell you have started, why the hell you have come so far from your home and started preparing in such harsh condition. So if you can sustain these environments, these harsh conditions, you can excel also. So I believe in you. Remember why the hell you started, why the hell you wanted this PG seat in your college of choice and the subject of choice, and this will give you the needed motivation. So tomorrow you will wish you had started today. Okay, so no need, no daydreaming, no procrastination, nothing is going to help you. Only thing which is going to help you is your work done. So don't stop until you make yourself proud, and actually you can. So work until you no longer have to introduce yourself to anybody. People will see you and say like that, yes, you are the one who have got this rank in this college, you are doing PG in this college, and many things else. So if you want something you never had, you have to do something you have never done, and this is the time. So life has no remote. Get up and change it by yourself, because it belongs to you. So nobody else can change it for you. So tell everybody that you are coming for the everything said that you couldn't. So nothing is over until you stop trying. So you should not stop trying. The time is still there for you, and if you work hard from now only, you will be able to achieve what all you are aiming for. So time is still there. Don't think that you have wasted a lot of time and the time is not no more for you, but it is still there. So we'll start with the course that I have been teaching for the high yielding stuff. That is something which is important for your exams and something which is going to help you. So here you will save a little time, and this will help you. I think there is some problem. Okay. So this is one of the question of exam like Aims. What is betaquinoline? What is the mode of action? So you know it is diaryl quinoline for MDR and XDR-TB. So it has been approved by FDA, and it inhibits the ATP synthesis, that is energy production, by inhibiting ATP synthase, and it may produce arrhythmia and cardiac arrest. So 2 questions for you for MDR and XDR-TB, betaquinoline. 3 question inhibiting ATP synthase and can produce arrhythmia and cardiac arrest. Now this is something which Aims people love, and anything which Aims love, NBE has crush on it. So whatever has been asked in Aims, it is equally important for your NBE. Okay, so this is basically the American brachytherapy guidelines, that how much Gyron you will be giving in different stages of this cancer cervix, CS cervix. So point A is in early stage you will be giving 80 to 85 Gyron. Note it down, it will help you. Advanced stage it is 85 to 90 Gyron. Now pelvic side walls in early stage you will give 50 to 55, little less, and advanced stage will be 55 to 60. Easy now. Absolute dose for rectum is less than 75 gyron, and for bladder it is less than 80 gyron. Now this is something which as a doctor you should know, and they also expect the same. So in investigation of choice for different gynecological conditions like fibroid, it is USG, tubal pregnancy, it is tubal patency, it is SSG, Mullerian anomaly, MRI always, endometriosis is laparoscopy, postcoital bleeding is PAPS, postmenopausal bleeding is endometrial biopsy. PID, pelvic inflammatory disease, USG, adnexal mass, USG, amenorrhea, hormonal assessment, molar pregnancy, USG, ectopic transvaginal ultrasonography. Ovulation is follicular monitoring. Hirsutism with menstrual irregularities is serum testosterone. Adenomyosis is MRI. Ovarian reserve is FSH. VVF is cystoscopy. Now this is something called the guidelines or the criteria for PCOD and the metabolic syndrome. So waist greater than 35 inches, triglyceride greater than 150, SDL less than 50, BP greater than 130 by 85, fasting glucose 110 to 125, and 2-hour GTT is 140 to 199 milligram per day. Also note them down. So these are the criteria which should be present for PCOD and metabolic syndrome. Now ice cream sign, very frequently asked and easy also on MRI, it is acoustic schwannoma or neuroma, and ice cream cone on CT temporal bone is the normal finding of incudo-malleolar joint. So another thing which AIIMS people and now NEET PG loves is asking the lambda sign and T sign. Now you should know how to differentiate this lambda sign and T sign. Lambda is seen with dichorionic twins, that is 2 placenta. Monochorionic twins have T sign. Now see the image very finely. This is the lambda sign. This is the lambda sign, and this is the T sign. I don't know, I'll skip my image for that. So this is the T sign for monochorionic. You can see a single line horizontal running T sign, and this is lambda. I'll show you in a better way. See, again, this is the lambda sign or the twin peak sign. Don't forget, don't make it wrong. This is the lambda sign seen in dichorionic twins. So this is the lambda sign or the twin peak sign. This is the T sign for monochorionic twins. So this is again a split membrane sign or for the dichorionic twins. Note the separation of amniotic membrane. So lambda sign for dichorionic twins. Again lambda sign here on the left side for dichorionic twins, and T sign for monochorionic twins. So I think you got enough, and I think this small effort of me helps you. So this is Dr. Shivam thanking you. Stay confident, stay healthy, and stay motivated. Thanks.